Back to the morning blend. Well, several things such as gum disease, tooth decay, and injuries can all cause missing or loose teeth. But you can get your smile back permanently.
Yeah, and here's the really good news. It's now more affordable than ever.
Dr. Brandt Bower is a dentist. He specializes in mini dental implants. Nice to have you in the morning blend. Good morning.
It's good to be back. It's good to be back. We came, I think, for the first time probably about 2 years ago or more. And since then, because of your program here, literally thousands of people have come to our office to take advantage of these mini dental implants, which we're just thrilled about.
It's
well,
fantastic.
anytime you've been here too, we always get so many emails, people wondering, you know, how can I find you? If they didn't see it, they just caught a glimpse of it or something. So you got to pay attention because he's back. So what is the difference between a mini dental implant and a traditional, which people are more used to?
Very good. We used to put in a lot of traditional dental implants. And the size actually is the difference. If it's 3 millimeters or larger in diameter, then it's a root form implant. If it's less...
Which is quite kind of wide there, right, doctor? I mean, it's a bigger, like, piece there.
Yes. On the other hand, if it's less than 3 millimeters in diameter, we term it a mini or a small diameter implant. I used to put in lots of these root form implants, but I almost never use them anymore. And there's several reasons. One is the price. Most traditional root form implants, when it's all said and done, cost about $3,500 to $6,500. Very commonly
Per tooth?
Per tooth, $4,500 or $5,500 per tooth. With these small diameter implants, since we came on your program, we've only been charging $500 for the implant and $500 for the porcelain fused to gold crown, or $1,000 for the complete thing.
That's amazing.
But the reason that the patients really like them is with these root form implants, before we can put them in, we've got to use these big burrs and make a big hole in the bone so that we can push that implant down into the bone, stitch it shut, and wait for 6 months for that to integrate. With these small diameter implants, we just use a tiny little pilot drill, make a little pinprick hole in the gum tissue.
Hold that real still here.
Okay, I'll let you hold it.
Okay.
Make a little pinprick hole in the gum tissue and a pilot hole into the bone, and then we can thread the implant down into that little pilot hole, and the threads of the implant become the root, and the top becomes the abutment. And so in theory and in practice, you can walk into our office at 11 o'clock in the morning, we can freeze it up, we can put the implant into your jawbone, and we can fasten a tooth on there, and you can walk out of the office smiling and talking and eating in less than an hour. And if you're like most of the patients, you won't even have to take a pain pill afterwards.
It's amazing.
We actually
way less than half the price.
For sure. And we have a testimonial from one of your patients who had the mini dental implant. We'll talk in a second about who's a good candidate for that.
Very good.
But first, let's hear from him.
I can chew, I can eat anything. We came down, free consultation, told us what he would do, how much it would cost. Perfect.
At the end there, he said, perfect. Who makes a good candidate? What has to happen? Do you have to have a certain amount of bone present in order to have a mini dental implant?
That's another great feature. We say if you have a chin and a cheek, you're a candidate. And it really is true. We don't need to bone graft usually, and if you're missing a tooth, we can replace it with an implant. And if you don't have any teeth, we can give you back fixed teeth, upper and lower. We're going to talk about that next segment. And actually replace all of your teeth and fix them in your mouth so that you never have to take the dentures out anymore.
I think it's fantastic, and so many people, you know, you hear when you go to the dentist, if you're missing a tooth, the fact that if you don't get it replaced, your teeth can shift, the structure of your face can change. So there's functional reasons, but again, there's cosmetic too. What do you think is the main reason people do it? Is it for that function or for the look, or kind of a combo?
The younger people want to look good, and the older people coming in, they say, "I just want to eat finally. I don't want these,
Yes.
and I don't want these dentures falling out anymore." And so they go for the fixed. But they really all look very nice.
Yeah.
Well, and I know you take a lot of satisfaction and joy. You see a lot of joy in having people return and say they can eat corn on the cob, or they can eat ribs, or they can eat foods that they've always enjoyed, but haven't been a sandwich, but haven't been able to because of missing or loose teeth.
For me, the most satisfying thing is when, especially if it's a young patient, comes up to me afterwards and gives me a hug and says, "Thank you, thank you, thank you for this smile and for my teeth." And that brings a lot of joy and satisfaction.
I think a smile truly is a lot of confidence for people to be able to open your mouth and enjoy laughing, smiling. That's, you know, how we display some of that emotion. And when you're constantly covering your mouth, you're not fully engaging in those feelings. And so I think it's a true gift that you give people.
And right now you're offering a free implant consultation with x-rays. So here's how it works.
No, not with x-rays.
Free implant consultation with x-rays. It's a $1,000 special offer, right?
Okay.
Okay. You explain it then, doctor. How does it work?
We have an inventory left of implants, and when those are gone, then our price will go up. But right now, $1,000 for the dental implant, the crown, and the abutment.
That's wonderful. And I know you have a limited amount of those, so you're hoping to get as many Morning Blend viewers as possible to be able to take advantage of this while your supplies last, which is fantastic. And people can call this simple toll-free number. It's 866-846-7486 or 1 Tooth or Gum. And people can visit you online at toothaurgum.com. A pleasure
Thanks,
to have
doctor.
you.
Thanks for having me.
Thanks so
Appreciate it.
much.